Hi, this is Dr. Bob Dannenhoffer sporting the new look for masks these days. And so this is a balaclava, and actually it works very nicely. And so it's just one of the many options for face covering. But again, since we have some people who read lips, I'm going to take this down so people can read my lips. So again, Dr. Bob Dannenhoffer here. Thank you for joining us for the next of our Facebook Live events. All of our other Facebook Live events and some short videos are on our Facebook Live, on our Facebook page and our YouTube channel. So I got that right. Okay, so we've got a lot of questions today. We'll talk I think today about masks. We'll talk quite a bit about testing. We'll answer any of your questions, and we'll go until we either get tired or run out of questions. So let me start here with a question that Barbara said. She said, do you think wearing masks gives people a false sense of security? Barbara, that's a great question because I think it could. So it's not like you could wear a mask and then just go back to regular life, because I think when we look at the importance of various measures, staying home when you're sick, the most important, social distancing, the next important, washing your hands, probably the next important, and wearing a mask to prevent asymptomatic transmission, probably important after that. So not nearly as important as those first three, as well as wearing masks can have two negative consequences. One is they give people a false sense of security. The second is that you do touch your face more when you wear a mask. I'm totally aware of touching my face, and I usually don't do it, but earlier this week when I was wearing a mask, I did touch it more. So masks are probably a good thing, but certainly not magic. So Barbara also asks, how do asymptomatic people transmit this? And this is going to be one of the big mysteries of coronavirus. We do know that people all make little bits of respiratory droplets, and when we talk, you make some respiratory droplets. But this degree of infectivity among asymptomatic and pre-symptomatic people is quite unusual for the diseases that we have. So we think it is, again, respiratory droplets. They make these droplets and people around them get sick. But that degree of infectivity is quite unusual for viruses. So one of the questions that came up earlier this week is, okay, Bob, you're the Douglas County Health Officer, and you're also with DPHN. Tell me what those things are about. So Douglas County is the county, obviously, and they have the legal authority to have the public health authority, and I work for them as the public health officer. And so that's a thing that's written into state law about public health officers. Public health officers have some responsibilities, such as preventing against epidemics, as well as some authority to do things like order quarantines. Thankfully, I've never needed to use that, but that's what the public health officer does. Douglas Public Health Network is a not-for-profit that we started in this county, and it's made up of the county and Aviva and ADAPT and a bunch of other organizations that came together to form this not-for-profit. And DPHN provides the services for public health in the county. So, for example, the lovely people who are sitting here today doing this are employees of DPHN, and they work at the direction of the county and the county health officer to do the things that they do. It has actually worked out great for the county because our flexibility in being able to hire new people is great. So Vanessa, who's here doing the questions, we could basically hire her in the space of about 3 hours. In addition, as a not-for-profit, we're eligible for grants, and I'm very pleased to say that as a not-for-profit, we got 2 grants this week to help us with our activities. So Douglas County, the government, they employ me as a public health officer, and then Douglas Public Health Network, which is the not-for-profit that carries out much of the work. That's a good question. So I work in the medical field. What's best for cleaning my clothes and masks? Genia asks. So the story with cleaning things, soap and water works great. So regular detergent, which breaks down the lipid part of the virus, kills it very well. And then warm or hot heat in the dryer kills this thing. So just put it in the washer and the dryer, it would take care of it. So Barbara asks, what do we know about long-term damage if you survive COVID? And we don't know about long-term damage because the longest survivors have only survived for 3 months. The story in China is that these people are sick for a long time, and they're not back to well for quite a bit of time. So we don't know if there's going to be long-term damage, but there certainly could be. So this is my number 1 or 2 question of the week. Do we have any idea when we can get back to normal life? Crystal asks. So when I have tough questions like that, I always take a second to think. And the story is, I think the new normal is not going to be like the old normal. I really don't think that the idea that you'd go and hug and kiss a bunch of people at a family party is gonna be normal for a long time. We visited France last year. It was a great trip, but everybody there hugged and kissed and whatever. I don't think we're going to get back to that for a long time, at least until we have a vaccine for this. But can we get away from the stay home, don't work, high unemployment that we have now? And I think the answer is yes. When? I don't know. I think I looked at this carefully today, and I think there are going to be 4 things that we need to have. First is we need to see this virus going down really dramatically and staying down for a while. I think in Oregon, the good news is that we've seen kind of a plateau. We haven't really seen it gone down yet, but once it goes down for a while, that will be the first thing you need. The second thing that you need is you need to have lots of testing with rapid turnaround time. So the testing we have now is okay. It's not that sensitive, hard to do, and the turnaround time can be very long. So sometimes it takes a week or more to get results. For us to really feel comfortable that we know what's going on, we have to be able to do a lot of testing. We have to have rapid turnaround time. And I think we need the antibody test, also called serologic testing, so we can tell who's had it, who hasn't. So disease has to go down. We need to have rapid testing. The third thing we need to do is we need to build back the supplies of PPE. So remember, hospitals, starting in about mid-January, stopped getting supplies. And so most hospitals, even if they've not had any cases, are running out of PPE. That PPE supply will start again, but that supply will just keep them going. It won't build back their supplies. So we need to both build back their supplies and have enough for them going forward. And how much is a big area of dispute, but it's got to be a fair amount, because the concern is once we start opening things up and people go back to school and go back to work and whatever, we could see a surge in cases. And if we saw a surge in cases and we didn't have enough PPE, that would be a problem. And the last, which I've seen today in the news a lot, is we need an army of people to help track down these cases so that when we do find a new case, we can track down those contacts and test them very quickly and know who's infected so that we won't have these outbreaks. That we kind of already have in Douglas County. Most counties do not have it, but we've been fortunate to recruit some out-of-work nurses and nurse practitioners to help us on this. So we already have it, but it's going to be a long time for other areas in the state to get this done. So the story is, are we testing enough people? No. I mean, we should be testing lots of people. We should be testing people serologically. That's with a blood test to see if they've had it in the past. We should be certainly testing all the people we're testing now, which is about 100 a week. But in addition, we should test random people who haven't been sick to see what the rate of asymptomatic carriage is. Because we do know that there's some people with this who are asymptomatic, and it would be nice to know what that background rate is. So the answer is absolutely not testing enough people. In the United States, President Trump said, we've tested 2 million people, but 400,000 of those have been positive. So the positive rate of 400,000 out of 2 million suggests a positive rate of 20%. That's horrifying. The positive rate in Douglas and Jackson County is about 2 or 3%. And really, we need to be testing so that our positive rate goes down to 1 or 2%. So with the rest of the country having a positive rate of 20%, we need to do a lot more tests. And we need to get the answers back sooner. I mean, getting the answers back a week later is really hard. So are there any new cases? We're still at 12. So we're still at 12 overall, but actually 4 of those people have recovered. So we only actually now have 8 active cases. This is actually the lowest number of active cases we've had in 2 weeks. So knock on wood, and this is a wood table. So knock on wood, we are doing great in Southern Oregon. Oregon overall is doing well. Washington, California, Idaho, all really struggling. Oregon, for whatever reason, is doing quite well. So are we nearly out of PPE in this area since we don't have sick people? Yeah. The reason we're out, how could we be out of PPE, is the reason is that hospitals typically have about a 30 or 40-day supply on hand. But starting in mid-January, when this heated up in China, and then in February when it heated up in Europe, all of that PPE got sucked into those areas, and basically shipments stopped. So we understood at Aviva back in end of January that there was going to be a shortage, so we upped our orders. We weren't able to order anymore, and in fact, our orders got canceled. So basically, most of these places have gone February and March with no resupply. So they're kind of running out of PPE because they're not getting resupply. So this has been a two-edged thing. One is we're using more because there are some sick people, and then it's not getting resupplied. So we're going to need a massive resupply to build back up those stores of PPE. So Courtney asked, do you see us getting another stay-at-home order in the fall once kids are back in school? That is a really good question. So the concern is that since we don't have a vaccine and we don't have any strong treatment for this, that what will happen is it may get better in the summer because everybody is stayed at home, but then when in the fall, if kids go back to school and the marching band starts marching at football games and we crowd around at football games, will this come back? And I think that is a concern. The thing we would hate to do is to have to do another stay-at-home order. I think if we're going to try and move things back, we would move things back slowly. And there are different risks for different things. So I had to buy supplies for some of the work we're doing here. So I needed to go to one of the fabric stores, and they were like closed down and nobody in the store. I think you could probably open up the fabric store as long as people socially distanced. But things like a concert where people are all yelling and screaming close together, that's probably going to be a lot later. So I think we have to smartly figure out what are the low risk things to open, and then what are the higher risk things. So for example, Susan Creek Falls, probably not really high risk. There aren't that many people going to Susan Creek Falls, and it's not crowded enough that you could probably do it. Multnomah Falls, which everybody is laying on top of each other, that probably is going to be later. So I think we want to be smart in when we open things up. So why are you not testing all healthcare providers? So if we had a nice rapid test and plenty of them, I think you probably would. Actually, the Bob Dannenhoffer dream is that all of us have these little cups that look like smaller than this, like little shot glasses. And every morning we all put them in our mouths, we gargle, we put them down, and while we're taking our shower, they develop. And if we're good to go, they're green, and if they're not good to go, we're red. And then everybody would know every day. We are probably a lifetime away from that. Testing all healthcare providers would be hard, especially if you have long turnaround time, because most healthcare providers who are well over 99% are going to be negative. So you'd have to do a lot of tests to find asymptomatic carriers. And by the time the test got back, if it takes 3, 4, 5 days, if they're asymptomatic, they're no longer a carrier. So it's because of the lack of testing, the difficulty of the testing, and the turnaround time that it's a problem. As well as I've had this test done. I did a video to show people how it was done, and actually Brian's daughter did it, and it is distinctly uncomfortable. And so I do not think with the current state of testing, having to have this deep swab, that people would come back on the second or third day. It is distinctly memorable. So how can Klamath County test anyone who wants one? And the story is anyone who wants one, I believe it has to be with a doctor's order. At least that's the rule that we got, is it has to be a doctor's order. And in Douglas County, anybody who has a doctor's order can get one. We have not turned down a single person. So anybody who has an order from their doctor can get one, but they have to have an order from their doctor. So do we have the antibody test here yet? No. 2 weeks ago now, they said it's right around the corner, and it's 2 weeks later, and it's still right around the corner. And so the Surgeon General said sometime maybe in the next 3 weeks. So again, this is like so much of the testing, lots of promises and poor delivery. So should we wear a mask while going for walks? So my recommendation for wearing a mask is certainly to have one with you, because there could be a time that during the walk, you couldn't socially distance. Let's say you had to help a little old lady across the street or something, and you couldn't socially distance. So I would bring a mask with me and put it on while I needed to do that. But at a time that I could adequately social distance, that is, be more than 6 or 10 feet away, there's absolutely no reason to wear a mask then. So I did a long walk yesterday, And I wore the mask, but only pulled it up one time when we passed somebody. So how many of the original 12 were in the hospital? So 5 of the 12 spent at least one night in the hospital, and only 2 of the 12 are still in the hospital. So we do publish those results. So Amy asked that she's 7 months pregnant. Is she more susceptible? Here is the best news. The best news is you're no more susceptible when you're pregnant than when you're not. And even if, goodness gracious, God forbid you would get it, it doesn't seem to be higher risk in pregnant people, and it doesn't seem to be a risk to the babies. So good news is you should be okay. So how many inadequate tests have been performed in Douglas County? Brittany asked, this is really problematic. Yeah, so we've had a bunch, and I don't know the number, but it's at least a dozen of the tests that we've done have come back as unable to do. And we tried to track them down today, and there are a couple of reasons. One is that sometimes there's either too much or too little mucus on the stick. So if you see the way I've done these, stick them in 5 inches, twirl them around, leave them for 20 seconds and pull it out. I have zero control of how much snot is on the swab. And if there's too much or too little, they can't run it. And that's one of those things that you just have no way to control. The other thing is the viral transport media has been in short supply. So some of the suppliers of this transport media have been putting less and less in the tube. And we're told that if the test comes out inconclusive the first time and they want to run it the second time, there may not be enough viral transport media. So we're switching now to saline with plenty of saline, so it should decrease the number of inadequate tests, but I can't control how much boogers are in there. Yeah, can you beat COVID by breathing exercise, coughing, and lying on your stomach, like Chris Cuomo says? So there are a couple of interesting things with this virus. One is prone positioning, that's laying on your belly, does seem to be a great advantage in this disease, and we're not exactly sure why. Because in most respiratory diseases, it doesn't make any difference. Now, babies, interestingly, do better on their bellies. So when we see a baby who's struggling to breathe, putting them prone will sometimes help. Breathing exercise, coughing, well, certainly with this you're going to cough, and breathing exercise certainly help because we know that people with better lungs do better. Now, whether they help you to fight the disease or just strengthen your breathing, we don't know, but I hope Chris Cuomo is doing well. So where are the cases located in Douglas County? All over. It's far north, it's far south, far west, they're all over, and so knowing where there is really not useful information other than everybody, if they're sick, should stay home. Everybody should social distance. There is no safe place in the county. So are we any closer to an effective treatment, Sydney asks. And so the answer is perhaps. So, treatments on this could be in several ways. One is something called convalescent serum. That's taking blood from people who've survived it. This has antibodies for it and giving it to people. That actually looks promising. The problem is, you have to have a lot of blood and a lot of plasma from people who've already had it. So it's probably not going to be widespread, but as more people have it and more people recover, we'll have more convalescent serum. So convalescent serum actually looks moderately promising. Chloroquine, which you've heard a lot about, study today from China suggested not very helpful. So every day it's helpful, not helpful, helpful, not helpful, helpful. So we're going to figure it out. They finally did do a nice controlled study where 500 people were enrolled, half got chloroquine and half didn't. Since this disease sort of shows itself in the space of a few weeks, really within 6 weeks we should know the answer here. Now there are some diseases that take a long time, like if I eat a better diet, will that prevent heart attacks? Well, you don't expect to have a heart attack in the next 2 weeks. So you have to do these for months and years until you know the difference of whether diet makes a difference for heart attacks. But in this, since the people have the disease, most people either survive or die within 2 weeks, we should know the results in 3 or 4 weeks. And we'd really like to know, because if chloroquine or one of those other things works, we certainly want to know about it. But also if it doesn't work, we want to stop, because hydroxychloroquine does have its own toxicity. So it has eye toxicity, it has liver toxicity. So if it works, we could put up with that toxicity, but if it's not working, we don't want to waste our time. The other one is remdesivir, which is an antiviral that was developed to fight Ebola. It did not work for Ebola, and they've tried it for this. The first report came out on that today. It was an uncontrolled study. A lot of people died in that, but a lot of people died from this illness. So again, there are controlled studies in there. Will let us know if it's better than placebo. So do you think we have peaked in Oregon? So this is a question I've gotten. This is my third most common question this week, is do we think we've peaked in Oregon? So remember, if you saw some of the initial projections, there was this really steep peak up and a steep peak down. And the problem is at the top of the peak, we overwhelmed our system. I think the answer is we did what we said we were going to do, which is to flatten the curve. So the curve is a long flat and then comes down. So I described what would happen if we did nothing as Mount Thielsen, really sharp peak and then come down. And what we're doing is more like the Coast Range, up. And where are we on the Coast Range? I can't tell if we're at the peak, just like you can never tell when you're driving over the Coast Range whether you've hit the peak or not, and then it'll come down. So I think it's going to be like the road to the coast. You go up a little bit, you come down a little bit, you go up a little bit. Maybe you'll get to a point where you finally are sure you're at the peak, but we'll only know at the peak when we have 2 weeks of downward. Right now, we're certainly not at the peak. I think, if anything, we're flat. Is a headache going on for 2 weeks now a symptom of the virus? And so the answer is there are a couple of symptoms. You know, we think of fever and cough as being the most obvious ones, but diarrhea is a weird one that's been showing up a lot of people. A long headache, but there are a lot of people get headaches for a lot of reasons. And then this back pain that people get seem to be common. So headache certainly could be consistent, but since so many other things cause headaches, not diagnostic. So Tara asks, our fourth most common question, is it possible that people had this in November, December, and January? And it certainly is possible. There's a lot of stuff going around in November, December, and January. So a lot of sick kids, a lot of kids with pneumonia. And so could this have been there? It's possible. I think probably not, because there might have been, had it been really widely circulating in November, December, and January, there might have been some deaths, and we didn't really see that. There might have been some hospital ICU admissions. We didn't really see that. But again, we're going to need the serology test to know for sure. So y'all going to start testing for antibodies? The answer is soon as they send it. And, you know, we've been asking for weeks now to be first on the list for this, and they still haven't delivered it. So when the Surgeon General says it'll be the next 3 weeks, it's likely to be in the next 3 months. So, so what should employers do, or employees do, when the employees aren't following the protocols set forth? So, you know, the governor has these orders. She causes things to be open and closed, and there's social distancing things and stay at home. However, we do not have the social distancing police or the other police. Now, OSHA is trying to enforce some of these things, so you can go through OSHA, but I like to avoid them if at all possible. I've had 2 calls today from people who said their employers were allowing sick people at work. So I called those employers and said, hey, you know, we've got a report here that you have sick people at work. Is that really true? And in one case it was, and we took care of it. In the other case, they said, we don't think so. So again, if people are worried about it, they can call public health, and I'll give them a talking to, but I'm not sure that works. So are we on the downside of the curve? Just like when you drive over the coast, you're not really sure you're on the downside until you get to Reedsport. I'm not sure we're on the downside here. I don't think we're on the steep upslope here. So we don't have it in first gear going up the hill here. It has been flattish over the last week. But just if you look at yesterday and today, the number of cases in Oregon varied widely. And because some of the test results are way out, I mean, we could get a slew of test results tomorrow and have 5 new cases. So I think it's too early to say we're on the downside, but I think the good news is we avoided that sharp peak. So when we go on walk, should we wear a mask? And the answer is only if you can ensure social distancing. If you're more than 6 or 10 feet away from people, you can't, except if you think it looks great. So will this come back in the fall, Patty asks. We don't know. So the story on the pandemic flu in 1918 was that it was really strong in April and May and then kind of went away. And people thought, oh, well, glad that's over, and then roared back in the fall. This one hasn't gone away a lot, so it may always be around. And my concern is that it's so all over the world that unless we stop doing everything, it's going to come back. So Peru and Ecuador, I mean, you could barely have places that are more warm, and those places are having big outbreaks. So I think we're going to see low-grade infection for a long time. So Mary asks, have I read the information on anticoagulation? I read a lot about anticoagulation, but I haven't seen that in COVID, so I'll have to look that up tonight. So can you give us more information on the new state task force, Diane asked? Well, there are so many of these. I think what you're probably asking about is the medical advisory panel that the governor asked me to serve on. So this medical advisory panel is 7 people in the state. You know, it's like the medical director at OHSU, Dr. Goldberg, who's a professor at the public health school, the public health officer, and all those. And so 7 of us have gotten together, and the governor asked us to help her find blind spots and advise her of places that will be pinch points. And so anyone who's been watching this knows what I'm going to tell her. I'm going to tell her that PPE is an issue, testing is an issue, and one of the pinch points is going to be the economy is really hurting. How are we going to get back to this in a smart way that's going to allow the economy to come back without causing the disease to roar back? So of the cases here, do you know if they got this from a long or short exposure? So almost all of the cases that we have here came either from a long exposure, like from a spouse, or came from a travel exposure. So we do not think that many of the people got it in Douglas County. So people travel on cruise ships, they travel on planes, they travel to other places. And we think most of the cases, especially the last 5 cases, were from prolonged contact outside the area. So where can one get a mask? The good news is you can get a mask a lot of places. So if you look at if you're talking about one of these, you can get these on Amazon. But if you want one of the hand-sewed masks, there's 3 different groups. In Reedsport, there's called Timber Faller's Daughter. Find them on Facebook. There's the Douglas County Helpers. Find them on Facebook. And Umpqua Sewing Warriors. Find them on Facebook. So how many pending tests were there from the drive-thrus? So we did a drive-thru today. Those are not back. We did a drive-thru on Tuesday. Those are not back. We did a drive-thru from Reedsport. Most of those are back. So it's this week's we're waiting for. And then there are a couple of tests from the 27th, so far ago, that we somehow don't have results for. This is maddening. We have somebody whose job it is to do these tests and track down these test results. And she's on the phone like the whole day trying to find out where they are. And it is so frustrating. And people say, Bob, you should just call and complain. Oh, we have tried that. It doesn't work. Would it help if patients would use a spirometer if they get symptoms? So a spirometer is this testing device that shows airflow. And it's a great thing for asthma. We use it all the time. Turns out that there's not a lot of airflow issues in these patients. So we do not think spirometry is that useful. The 2 things that are most useful in this is measure of shortness of breath. So what people do is have people hold their breath and then count. And most people can count to 10 or more. These people can only count to 1 or 2. And the other one is an oximeter, which measures oxygen. Those go down really quickly. So why are we so low in cases when counties and countries around the world are so high? Don't really know. I mean, I attribute it to the great staff we have here who've done such a great job, and to good luck. So we look at a lot of models, and when we look at models of states around us, actually the other states around us are all so much higher than we are. And so, things in Washington and some things in California are not all that different from where we are. Why we're so low, we don't know. And why is Douglas County and Coos County so low when Lane County is higher? And again, we don't know. It may be because people travel less in these areas than perhaps they travel in other areas. Any more questions? Okay, let me go through a few things here. So one of the questions is about masks and how do masks help. So I'd refer you back to our YouTube video, our little Mythbusters thing that looks at how the masks work. So masks work a little bit to protect you, but they really work mostly to protect others if you're starting to get sick with something. The second question is about testing. Again, 3 kinds of testing. One is the testing we're doing now using the PCR test that we have to send away either to the state lab or to Quest or to LabCorp. That testing is getting better. The times are coming down a little bit, but still it's a very complicated supply channel and a complicated time to get it back. There's rapid testing, and there are a couple places in town now that have rapid testing, but they have just very limited amounts, just a few tests each, because the cartridges that you need for this are in short supply. But it's a lot more than we had last week, so the hope is that that rapid testing will improve, and then the serologic testing. So the question is, are you sick? You coughed. No, I just talked too much today. This is the 4th interview I've done today, so I've just talked too much. So let me take a drink. I've just talked too much. I'm really not getting sick. Actually, one of the things that we were saying, and haven't said that much today, is about taking good care of yourself. This is for many people a very joyous time. For those who the Jewish religion, this is Passover and the time of the Seder. For Christians, this is the time where we celebrate Easter. And so really should be a joyous time, and a time really for us to rejoice that Douglas County has done well in this. But a sad time. I mean, as I said today on KQED, my cousin is a New York City policeman. And so I talked to my mom last night, and she said he is spending his whole days. They get called to an apartment where somebody has died overnight, likely of COVID, and they wait there outside the apartment until the coroner arrives, and the coroners are so far behind that it's sometimes a whole day that he has to stand in front of the door until the coroner arrives to pick up the dead bodies. That every day there's hundreds of these, of people who are dying in their apartments before they get to the hospital. My mom also said, Robert, I saw the hospital that you were born in, which is Wyckoff Heights Hospital in Brooklyn. And she said there's just trucks outside with rows and rows of dead bodies. So it really touches home for me to hear those stories. This is where I grew up. This is where my relatives are living. But I'm joyful that here in Douglas County we've not had it nearly so bad. So Lori said, are the medical facilities the only one to receive a rapid test kit? Yes, it's only medical facilities that can do this. This is not something you can buy yourself. So they are medical facilities, and there's some evolving details here, so I think I will save those for next week. So is it safe to spend time with small groups of family members who are also quarantined otherwise? So this is a question for me. So my son and his girlfriend are quarantined together, and then my wife and I are kind of quarantined together. And the question is, can they come over for dinner this weekend? Well, it's not a huge risk. It's not like the usual Easter parties we had at our house where there were 80 people coming from all over the area. But it's still more risk than talking to them on the phone. And again, we're not asking people to go to zero risk. There is a little bit of risk there having family members in small groups. Again, there's no quarantining police here. And so you have to make the decision for yourself. My brother, who lives back in East with my mom, said, should he go visit my mom? And the answer is, well, no, because he's worried that if he goes and he hasn't, gives it to her, that she's 90, so she has a high risk of dying. So, oh well. So there are a lot of people who served in this. So Kelsey said, yeah, I mean, there are tremendous people. The stories back east where people have gone to working in these hospitals with less than great PPE to take care of people are just amazing. And so after 9/11, when we saw the firefighters and the police do that stuff, that was really heartwarming. And it really is heartwarming to see this. So I'll stop here a second. Do we have more questions? All right. So it's getting to be 6:30. I hear it's 7 o'clock. We're going to be celebrating all the workers. So we're going to let you go a little bit before that. In New York City, they have this deal where people are banging on pots and pans to celebrate the healthcare workers at 7 o'clock EG. So we're going to stop before then, so people can do that. Sorry for tearing up. I mean, that in New York City is incredibly... So what do you say to people who think we are overreacting? Oh my goodness. You only have to hear that story from my cousin. You only have to see that neighborhood that I grew up in with rows and rows of refrigerated trucks. And the answer is, oh my God, we're not overreacting in New York City. Now, we acted early here. And in Oregon, we acted early. And some people would say, well, maybe we overreacted in Oregon. Maybe we could have waited another week or two to go ahead and do the tightening. Maybe we could have, instead of stay at home, we could have try and stay at home. We could have done those things differently. And in retrospect, this will be a lot easier to tell. I think people will both be criticized for doing too much and too little. And what I tell people is that when we have people who work with us in preparedness, and the first day we say, this is what you should expect. You should expect never to be right. Because if you're in preparedness and you do something too early, you evacuate a town before a hurricane, you save too much equipment than you need and it goes out of date, you'll be criticized for doing too much. And then if things go bad and you didn't have exactly the amount of equipment you needed, or you didn't evacuate on exactly the right day, you'll get criticized for doing too little. And since our ability to predict the future, especially in epidemics, is terrible, you're always going to get criticized for either over or underreacting. I think Oregon remarkably has done right, and I would say that's good luck. So people have asked, one of the things I made a presentation today about the projections of what's going on. And what I said is that this is a lot like weather predicting. But let's think of weather predicting. For weather predicting, there are thousands of people who spend their entire lives doing weather predicting, and they have every day of weather to work on. They have satellites collecting millions of bits of data, and they use these Cray supercomputers to figure out what's going to happen. I said the predictions I made, well, we've only had one pandemic since 1918. We didn't have very good computers back then. So this is really our first pandemic. We're using thousands of bits of information rather than millions of bits of information. And I'm doing this on my little Dell laptop. So our ability to predict these pandemics is nowhere near as good as the predictions we have for weather. And the predictions for weather now are pretty darn good. But the amount of data we're working on this stuff makes it hard. So much talk about chloroquine and remdesivir. And does our local hospital have these drugs available? So remdesivir is only available with compassionate use, and presumably they could get it. So compassionate use means that this drug is not approved for use, but you can, in an emergency, call for its use, and certainly our hospital could call for that. There are also some studies on remdesivir. The remdesivir are usually done in big hospitals. I hear the hospital in Spokane is one of them, usually not in small hospitals like Mercy. And chloroquine, I think we have some chloroquine around. Again, we don't know if chloroquine works. Chloroquine does have some toxicities, so it would really be up to the individual doctors to know whether they want to use either chloroquine or remdesivir. But as I said, there are only 2 people in the hospital at this point, so it's not a lot of people to work on. Is that it? Okay, well, it's 6:38. So again, a couple of things. One is look at our stuff on Facebook Live. The Mythbusters now has lots of views, which is great. Sorry I teared up there for a bit, but I will. And it's 7 o'clock. Bag on pads. So, okay, take care.